So I want to make a distinction between public health and population health. Population health is really what we do to study populations in terms of their risks and health promotion, what promotes their health. And public health is really where the rubber hits the road. That's where we take the data and the information from population health and apply it and really think about, if you will, public health practice and what we need to do to protect the population as a whole, if that makes sense. So one of our main key public health practices is surveillance and evaluation of policies and programs. And so when we talk about surveillance, we're talking about not big daddy or big government looking over, but really medical epidemiologists, statisticians, health scientists really having a pulse on, what is the proportion of the population that's having a particular health problem and why, what is causing it, what might be the reasons behind it. Once we have that information through the data, we in public health can make decisions to help prevent or remediate those problems at a larger level. We also focus on communities, specific communities, to understand their health and their health needs. Given that they are going to have a foundation in the first year around their coursework, and then in the second year, they're going to have the applied practice and integrated learning experience, we foresee that graduates from the MPH program at Wingate will have a multitude of different opportunities. Data analysis and data analysts, working in surveillance with surveillance groups, health education. We see them actually working with large health programmatic work to both implement, evaluate, and then actually work with policymakers in terms of what do we need to really, if you will, push the envelope and make a greater impact across the populations with the use of policies. What makes our program distinctive, I'd like to talk on several things. One is the fact that it is in the Levine College of Health Sciences. So there will be an opportunity for students to actually interface with other health professions programs that are more clinically focused. Really takes that interprofessional education approach, which we're really excited about. It also speaks to helping the non-traditional learner in terms of its online format. And so students can learn remotely through our asynchronous format. And but in addition, I do think that it's going to be critical to highlight the fact that the students are going to be able to interact with many different faculty, from those in the Levine College of Health Sciences to even the business school. So they're going to get a very multidisciplinary program. The beauty of the MPH program at Wingate is it takes an integrated curriculum approach, and it focuses on health education and promotion as the track. And so because of the integrated curriculum, students are going to get if you will, everything in their courses, from epidemiology to environmental health to data science, understanding how to collect data, analyze data, biostatistics. They're going to also learn about health policy and all we do in terms of public health practice. And because of that, they're going to have a wide array of different opportunities in terms of jobs coming out of the program. So we opted for health education and promotion for several reasons. We did feel that this would give the students in the MPH program a very integrated approach to learning about the many facets of what we do at a population level and in public health functions. So in this area, students are really going to be able to not just learn about, the nuances and the importance of epidemiology. They'll get that grounding and foundation, but they'll really be able to take that knowledge in terms of the data and apply it. Really think about, how do we use data to make a difference in populations and communities? How do we apply that information? How do we make a story from it? And then find solutions that will help to promote health and prevent disease. A remote learning program really helps and speaks to professionals who are clinicians, who are working, who want to pursue a degree in MPH, that they can do it remotely and do it while they're working. The asynchronous manner of the public health classes allows them to self-direct their learning, while we have live virtual meetings with the instructors allows them to interface with other students and the faculty in the public health program. So the coursework actually is asynchronous and self-directed, but we do offer optional live virtual meetings in the evening, optional meeting that students do not have to attend, but it provides an opportunity for the students to meet their instructor online and talk to other peers. Those optional sessions are going to be taped, and so students who cannot make it will still be able to view those sessions. An example would be working with a local health department and helping them identify, they may see a community that is increasingly using substance, alcohol. Why is that happening? A student might be doing an applied practice with the local health department, understanding the data, understanding the structure of the community, and looking at, for example, what does alcohol marketing look like in this community? Assessing, is there a significant density in alcohol marketing? Could that be driving alcohol use? Is it the pricing? What's going on with pricing of alcohol in this community? So the ideal MPH student is an individual who's excelled in their bachelor's degree with at least a 3.0, and actually is coming into the program with critical thinking skills, perhaps some community and or clinical experience, maybe some research experience, really focused on looking at health more widely, understanding that health, there might be certain populations that experience disparities, and really coming in to think about how they can critically develop solutions to those problems. So why is it important to go into public health? I think now more than ever, we really need to strengthen the infrastructure of public health. And what does infrastructure mean? It's not just the healthcare systems and the medical systems, but it's every organization, be it governmental, non-governmental, that can influence health in a positive way and prevent disease across populations. We need folks that are well-versed in data science and data interpretation. We need graduates who can go out there and really be the voice for the community and actually help to educate and promote the important messages we need for communities to be healthy. This is really critical for our future generations. I can't stress that enough. Take tobacco control, prevention, and control. The policies that have been implemented for decades have made incredible strides in reducing the norm normalization of tobacco use, smoke-free policies are very critical in having done that. We could not have had those accomplishments and made achievements in that area had it not been for the science and for the public health workforce really educating policymakers.